Welcome to Ararat Healthcare and Charcos Learning Centre, your one-stop solution for IELTS, OET, CBT and Osce training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your Osce on the first attempt, please visit our website on www.charcoslearningcentre.com to register and book our unique Osce portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock Osce test. So don't delay, you're achieving your dreams any longer and sign up now. Removal of catheter. When the removal of catheter is undertaken using clean technique and not ANTT, you do not need to wear sterile gloves, but you must continue to wear gloves and an apron prior to manipulating the catheter and when undertaking the skill. A dressing pack and saline may be available at the station should you wish to clean the genitalia of the patient. However, this is not a requirement for the Osce. Entering the room, checking it's safe to do so before I approach my patient and doing my hand hygiene. Using the gel, palm to palm, palm to palm, fingers interlaced, palm to palm, fingers interlaced, fingers interlocked, tips of the fingers, rotation of the thumb, and finally the wrists. Hello.
Hello.
My name's Julie, I'm one of the nurses here. I'm going to be looking after you this afternoon. May I know your name, please?
My name is Helen Craig.
Okay, and what would you like to be called?
Helen.
Helen. Okay. Helen, would you be able to tell me your date of birth, please?
Yes, it is 6th of June 1950.
Do you mind if I just double check that with your wristband?
No, please go ahead.
Okay, so Helen Craig, date of birth 6th of June 1950, and your hospital number is F001, F001HC, F00101HC. Helen, I see that you've got a red wristband on here. Do you have an allergy at all?
Yes, I'm allergic to penicillin.
And what happens when you take penicillin?
I get rash all over my body and my throat swells up.
Okay, so when did that happen?
It hasn't happened recently. I've been quite careful.
Okay, well, we'll make sure that you don't get any penicillin whilst you're here because it is written on your notes as well, and you've got your red wristband on. So, do you have any other allergies that you're aware of, perhaps to any adhesives or dressings at all?
No, I'm fine with everything else.
Okay. I need to take your catheter out for a trial without catheter. Is that okay?
Yes.
Okay, so what that means is the tube that's in your bladder at the moment is held in by a balloon. So I need to deflate that balloon and just pull gently to remove the catheter. It does cause a little bit of a stinging sensation, but it doesn't actually hurt as much, and as soon as it's out it should resolve itself. Is that okay?
Oh, that's good. I think
Okay.
It's
Okay. Now, although I won't need to expose you too much, would you like to have a chaperone present whilst I do this?
No, I'm fine.
Okay, and would now be a convenient time to do that?
Yes, please.
Okay, so I'm just going to pull the curtains to give you some privacy and go and wash my hands and get my equipment. Is that okay?
Okay.
Okay, so I'll leave you with the call bell should you need anything, and I'll be straight back.
Okay.
Okay? So I'm going to wash my hands, making sure to use the elbows, wetting my hands, applying some soap, palm to palm, palm to back, palm to palm, fingers interlaced, fingers interlocked, rotation of the thumb, tips of the fingers and the wrists. Then I am going to rinse. Using hand towels from the tips of the fingers down to the wrists. I'm going to make sure my hands are dry. dispose of the towel in the domestic waste. Making sure that my hands are thoroughly dry. So, I'm back with everything, Helen.
Hi.
Hi. Okay. Have you ever had a catheter in before?
No.
Okay. So as I said earlier, there will be a bit of a stinging sensation, but hopefully it shouldn't last for too long, okay?
Okay.
So, what I will need you to do is just lift your bottom slightly so I can put a little pad underneath, so we don't soil the sheets. Is that okay?
That's fine.
Okay. Okay, so, okay, I'm just going to lift the bottom of your sheet up. Okay. And under that goes. Thanks for that, Helen. That's it, rest down. Okay. So, I am going to check that the drainage bag is empty, and if it's not, I'm going to empty it. As it is empty, I am going to place it on the bed and get clinical waste bag and put it straight into there, and take these gloves off, dispose of these gloves to try and be as clean as possible with the procedure. Okay, you alright, Helen?
Yes.
Okay. Here we go. My hands are all sticky with the gel. I'll find some fingers in there somewhere, Helen. Okay, so I am ready. I have a alcohol wipe, and I am going to clean the port of the catheter for 30 seconds and allow it to dry for 30 seconds. I'm going to get a 10ml syringe, because I read in your notes, Helen, when they put the catheter in, that they filled it up with 10 mils of water, and it also says on the catheter here that it's filled up with 10 mils of water also. So, putting that into the cleaned port, I'm going to let it slowly refill back. I'm not going to put any pressure on that. I'm not going to wait for that syringe to fill up itself. Okay, have I got 10 mils? Okay, so I'm ready to remove this Helen. Okay, so what I would like you to do is to take a deep breath in, okay, and when I say, I'd like you to cough and release, okay? Ready?
Yeah.
And go. Cough, 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 cough. All done. Out. Putting that straight into the clinical waste. And Helen, I'm just going to pull this out from underneath you. Okay, well done. Thank you. I'm going to dispose of my gloves and my apron in the clinical waste. I'm going to seal this bag and take that away, do my hand hygiene, and put your blanket back. Okay? Okay, so Helen, what I need you to do now is drink as much as you can. Okay, really increase your oral fluid intake so that we can get things flowing through naturally as quickly as possible. Okay, I'm going to come back with a pot. So next time you need to pass urine, I'd like you to do it into the pot so we can assess the colour of the urine and we can assess the amount of the urine. Obviously, if you start getting uncomfortable at all and you feel that you can't go, please use your call bell and let us know. Is that okay?
That's fine.
Okay, so I'm going to take all this stuff away and document in your notes the time that we've taken your catheter out, and obviously we need to keep an eye and make sure that you do pass urine. Okay? Thanks you. Thanks for your cooperation. Pull the curtains open and take the equipment away.